The objectives for this really to talk about the goals of calcaneus reconstruction. We're going to review some small incision techniques, and I'm going to talk about tips for reduction. These are universal tips to whichever method you're using for fixation. So why do we fix them? To prevent problems from bony deformity. And it's important to keep in mind that the poor surgical candidate is often a poor reconstruction candidate because it requires usually bigger incisions, more hardware, and a shortened and tight soft tissue envelope. This is an example of a variety of calcaneus malunions from my practice. These are the worst ones. These are the ones that someone operated on, didn't reduce it, and it's infected. So if you're going to operate, you want to do it correctly, and you want to reduce the fracture, and you want to do it in a manner that will hopefully avoid complications. And part of this is you have to have some experience and familiarity with calcaneus fractures. The literature shows that the more you do as an individual, the better your outcomes will be, and the less complications that you'll have. So it's important to keep in mind. CT is certainly essential for planning. It requires knowledge of fracture patterns and the ability to translate the information presented in the CT scan to what you're going to look at through your approach, whatever type of approach you choose to do. So here are some models of a fracture. The top one is a tongue type, where the posterior facet is hooked to the back of the calcaneus, and then the lower one is a joint depression. You need to be good at setting up the patient, as Sam went through. This is how I do it. I oblique the bed from corner to corner in the room, and I bring the CRM in from the opposite side, and you can see how the patient's set up there. So my lateral view is just shooting straight down. For the Broden views, you flex the knee and internally rotate. And if I want to get the axial image, this is how we do it. I don't have to lift the leg up. I don't have to move it. And I can do this by myself, just like Sam said. I don't need additional hands. I use the real CRM, not the mini one.